Welcome to Mock Interview Pro, where we're here to help you shine in your upcoming health advocate interview. Let's dive right into the first key aspect of your role, effectively communicating complex health information. So, here's our first question. Can you share a time when you had to explain complicated health information to someone who wasn't familiar with it? How did you make sure they understood? This question helps interviewers understand your communication skills, especially your ability to simplify complex topics for different audiences. Let's look at some strategies to tackle this question effectively. Think of a specific moment when you explain health information. Use simple language and relatable analogies to make the information clear. Check their understanding by asking questions or having them recap. Tailor your explanation to suit their background and knowledge level. Provide additional resources or information for further learning. Now, let's explore an example of how you might answer this.
In my previous role, I had to explain diabetes management to a patient who was not familiar with the condition. I used simple terms, likening insulin to a key that helps the body use sugar. After explaining, I asked them to summarize what they understood to ensure clarity.
By the way, we're only covering a handful of questions in this video, but I've prepared a free PDF with all 30 top interview questions for Health Advocate. It also includes example answers and tips to help you prepare with confidence. The download link is just below. Tell me about a time when you disagreed with a coworker regarding a patient's care or treatment. How did you handle that situation? Interviewers want to know about your conflict resolution skills and your ability to collaborate with others in patient care. Here are some tips to help you answer this question. Be specific about the situation and the root of the disagreement. Describe what led to your disagreement and why it was important. Show how you communicated your concerns respectfully. Emphasize collaboration and working together to find a solution. Reflect on the lessons you learned from the experience. Let's see an example of how you could respond.
In a previous role, I disagreed with a coworker about a patient's medication plan. I felt the dosage was too high considering the patient's age and health. I respectfully shared my concerns in a team meeting and suggested we review the patient's medical history. We consulted with the physician, who adjusted the plan accordingly. This taught me the importance of open communication in patient care.
Could you give an example of a situation where you effectively advocated for a patient's needs? This question assesses your advocacy skills and your ability to act on behalf of patients. Here are some pointers to craft a strong response. Provide a specific example from your experience. Clearly describe the patient's needs. Detail the steps you took to advocate for them. Highlight the positive outcome and its impact on the patient. Reflect on any insights gained from the situation. Here's how you might structure your answer.
In my previous role, a patient was denied a necessary medication due to insurance issues. I gathered the required medical documentation, met with the insurance representative, and clarified the patient's condition. Ultimately, the insurance approved the medication, significantly improving the patient's health.
How would you handle a situation where a patient's rights are not being respected by a healthcare facility? This question evaluates your problem-solving skills and dedication to patient advocacy when faced with challenging situations. Consider these tips when preparing your answer. Identify the patient's rights that are being violated. Collect relevant information from the patient and any witnesses. Approach the facility's management or patient advocate. Document the situation thoroughly with facts and evidence. Follow up to ensure the issue is resolved. Now, let's look at an example response.
I would first identify the specific rights being violated, then gather details from the patient about their experience. Next, I would report the issue to the facility's management or patient advocate, providing them with the documentation I collected.
A patient is unable to afford their medication and asks for your help. How would you address this? Interviewers are looking to see your empathy and problem-solving abilities in helping patients with financial challenges. Consider these strategies to answer this effectively. Listen to the patient's concerns and show empathy. Ask about the specific medication and its cost. Research available assistance programs or discounts. Guide the patient through the application process for aid. Follow up to ensure they receive the necessary support. Here's an example of how to approach this question.
I would start by listening to the patient and understanding their situation. Then I would ask them which medication they need help with and check for any patient assistance programs offered by the pharmaceutical company. I'd help them apply for these programs and follow up to make sure they get the help.
Before we wrap up, remember you can get all 30 questions, example answers, and step-by-step tips in a handy PDF. Totally free, just grab it below.